All right, good morning. So today we are going to go over the second and last portion of this chapter's lecture notes. So as always, just make sure you are titling it whatever the name of the lecture is. So it's going to be Personal and Professional Qualities of Healthcare, Lecture Notes Part 2, and then making sure that you guys are submitting this by the end of the period. All right, so today we're going to cover communication. Communication is so important when it comes to having a job. I mean, it's important right now, especially with distance learning. That's why I'm telling you guys, if you ever have issues, just reach out to me. If you don't reach out to me, then obviously I'm not going to know what's going on. So anyways, in healthcare though, definitely super important. As a healthcare worker, if you do plan on pursuing a career in this profession, you have to be able to relate to not only the patients, but also their family members, your coworkers, and then anyone else that is also going to be working alongside you. So again, I think I've mentioned if you plan on working in healthcare, you're going to be dealing with several different professions, be working alongside them. And it's just really important to make sure that you understand what teamwork is and that you're able to communicate your needs as well as your patient's needs and so forth. So, what is effective communication? So, communication in general is just exchanging of information. It's that exchange of thoughts, your ideas, and feelings. You also have this other component to it as well, which is also listening. So, you can also there's two major components. Obviously, you're verbally speaking to someone, but it's also super important if you are trying to have good communication skills that you're actually taking the time to also listen to what people are saying to you. And so I'll talk about that in a moment. But with just communication in general, you have your verbal. So those are your spoken words. Those are things that you're obviously saying to your patient. And then you have your written communications. Those are things that you're recording. Sometimes you might have a patient that doesn't have the ability to communicate verbally. And we'll talk about that in a moment, but maybe writing things down for them. And then you have your nonverbal communication, which I think is so important. This includes your facial expressions, your body language, and also your sense of touch. So we'll go more over that, but nonverbal is super, super important because if you have a confusion with what you're saying and what your facial expression looks like, then you're going to have issues with your patient or maybe a coworker or a family member of the patient understanding what you're actually trying to say. And then this goes into the listening part. So listening is huge when it comes to communication. I will be the first to admit that there are times where I don't do the best job as a listener. So if you ever come into my training room or if you've ever been in my training room injured, oftentimes I will repeat things back or I might ask the question more than once. And it's not because I'm not listening. It's just I don't know about you, but sometimes it takes me a couple times to actually like fully grasp what someone's trying to say. So I often, if you look down here, I will reflect the statements back to the speaker. So, that means they will say, oh, okay, I got injured this way. And then I will say, okay, so you got injured doing this. That helps me to process exactly what they are saying to me so that it's not just going in one ear, out the other. Like I said, I need constant practice at this. I think just in general as humans, it's not really hard for you to be a listener, but you're always wanting to talk more about what you have to say. So just practicing it, paying attention, and trying not to talk over people, that sort of thing is important as well. All right, so your nonverbal communication, like I mentioned, super important. Your facial expressions, your body language, your gestures, eye contact, your touch, all of those can indicate how you are feeling, and they can conflict with your verbal message. So you can say something like, everything's going to be okay. But if you look like you're panic on your face, then someone's going to be like, what? Because those two are conflicting with each other. Or you say, have a nice day, and you look not so happy, then again, that can be something where there's going to be that confliction of the verbal message. So just making sure that you're aware of your nonverbals. If you're standing and you have your arms crossed, that can just show that you're uninterested, you're not excited about working, maybe you're irritated. Could mean nothing, but it just kind of it's a universal sign, so it might be interpreted the wrong way. So just being aware of that so that there's no confusion. And then you don't always need to actually verbally speak to communicate effectively. You can point at things. Like I said, there might be people who have issues with communicating verbally. So if you're able to ask them to point at something, smiling obviously is another thing. I can smile and someone will know that I am, maybe reassuring them. I'm showing some type of positive display. That doesn't have to, I don't have to say I'm happy. I can smile and that can show it. And so it's just really important to make sure that your verbal and your nonverbal communication are the same so that you're not confusing your patient, again, their family members, your coworker, even boss, and so forth. All right, so there are some barriers to communication. So a barrier in general is just something that gets in the way or limits your clear communications. So in the hospital setting, this is very important. I know I've said very important a lot, but it's super important because you're talking to someone about their medical diagnosis and you want to be as clear as possible with them, and you want to make sure too that they understand what you're saying. So some common barriers, which we'll talk about, you have your physical disability barriers, you have your psychological attitudes and prejudice barriers, and then you have your cultural diversity barriers. So there are more than this, but these are like probably going to be the most common ones. And again, I'll talk about it in a moment. All right, so the physical disabilities. I briefly talked about it, but if somebody is deaf or is suffering from hearing loss, this is typically people who are elderly, but it's not always the case. There are people too that are younger that have these issues as well. It's just important to be aware of that, making sure that you're using your body language as best as you can. You can give them paper to write things down so that you're able to communicate with them. Or if you're able to, if you're working in a setting where they do have interpreters, so like in a hospital, you would have someone that is probably able to interpret sign language, so that's the ASL, utilizing them to your advantage. If somebody is blind or vision impaired, it's super important to make sure that you are announcing your presence when you're entering. If they're in their room, you obviously don't want to startle them. They're not able to see like a seen patient. So you want to make sure that you're not startling them, you're not scaring them. You want to make sure too that you're talking in a soft tone. Sometimes when people deal with someone who is, let's say, blind, sometimes they will talk to them really loud or they'll talk to them really slow. Somebody who's vision impaired, they're not having issues with their hearing. So it's just important to keep that in mind. It's, people make that mistake all the time. So just making sure that you're not treating them like they have other conditions, unless obviously they do. And then you also can have aphasia or speech impairments. So aphasia is like the inability to actually formulate sentences. So the person can process thoughts. It's not like they, have some type of mental disability. It's just that they're unable to actually physically speak. So again, you want to make sure that you're using a soft tone around them as well, because they're not mentally incapable. They just are having issues communicating, and it can be really offensive to someone if you're talking down to them or speaking really loud when they don't actually have something like a hearing issue, that sort of thing. But same thing, if they're unable to communicate verbally, asking them to write things down on paper, you can use what are called picture cards. So in a hospital setting, you can use these cards. Basically, they'll have like common pictures of things, and then the person can then communicate using those picture cards. So different things, you just need to be aware of them as well. Psychological attitudes and prejudice. So this is huge. I think you guys have probably become more aware than anyone, your generation at least, when it comes to things like this, especially like with what happened this past summer. But it's just super important, especially in healthcare, that you're not judging someone based on their appearance. You're not judging them based on their lifestyle. You're not judging them based on their social or economic status. And it's really hard for people not to do that. You need to keep in mind that every single person deserves the same quality of care, no matter what they look like, no matter where they come from. And again, it's kind of human nature that we kind of do that sort of thing. And it's unfortunate, but it's something that we need to try to break, because again, a homeless person deserves the same quality of care as somebody who is a millionaire. And it's just important to keep reminding yourself of that. I mean, even me as, someone that works as an athletic trainer, I have to treat everyone the same way, and that's super important. And sometimes you might judge someone, let's say somebody is overweight, and you're telling them you need to, you know, um, go on a certain type of medication or maybe work out or eat healthier, and they continue to refuse, and then they keep coming back into the, hospital or that sort of thing, and they continue to keep doing the same things that you're telling them not to do. You just have to be super patient. Again, you might see someone that's overweight, they're smoking, they're doing everything they shouldn't, and they're, high risk for a lot of different things, and they keep coming back. You just have to be patient. So the biggest thing is just being patient and just open-minded. You're not judging people based off of what, they look like, where they come from, their lifestyle choice. As difficult as sometimes that can be, it's just really important for you to keep that in mind. And then last thing is cultural diversity. So some of these things I didn't know going into the medical field, but it's definitely something that you need to be aware of, especially if you're working in a hospital. I work in athletics and I work in Orange County, and I feel like the majority of people have very similar cultural beliefs. There might be a little bit variance, but when you're in a hospital, you're opened up to more diversity. And so it's just important to keep in mind that other people have different beliefs. I kind of talked about it a little bit when we went over like alternative medicine, but just your job as a healthcare worker is to give them the best advice and treat them the best way that you can. And then it's kind of up to them to do what they need to do. So some cultures, their beliefs regarding like health and illness, they might believe that a certain medical condition is caused by something else. So it's just important to kind of educate them and then let them make whatever decision it is that they want. Language differences are obviously going to be a huge issue. If you don't speak multiple languages, then you're going to need to utilize an interpreter. Eye contact is also something that's important. So, or just to be aware of. I eventually will teach you guys about how to create like a quality resume, prepare yourself for finding a job. And so one of the things that you guys need to do is do an interview. And I always mention you need to make sure that if you're doing a job interview that you're making eye contact with someone. However, there are some cultures that think that eye contact is a sign of disrespect. So even people who are hiring people for jobs need to be aware of that, because they can't, penalize someone for a position because maybe they didn't show eye contact, because maybe in their culture eye contact is a sign of disrespect. So that's important too. You might have a patient that's from a different culture, you're trying to talk to them and they're not looking at you, and for me as a teacher, if I think a kid's not looking at me, I'm going to think, okay, well, they're not paying attention. Same thing with the patient. It just could be though that they are listening, they just don't want to show eye contact, because again, that could be disrespectful according to their culture. So just being aware of that as well. Some cultures too, when dealing with terminal illness, don't think that they should be told the truth. So in the United States, our culture typically in the United States, we believe that patients should, have as much honesty when it comes to their medical diagnosis, but depending on the culture, sometimes they don't think that it is up to a healthcare worker to say that. They might believe that, there's this higher power, they're the only ones that are responsible. So again, just being aware of that as well. And if they choose to, they might, handle the terminal illness with alternative treatments, or maybe they might use, let's say we're talking about cancer, they might use chemotherapy and then maybe also acupuncture. Or maybe they choose to do no chemotherapy and all they choose is herbal medicine. It's just important for you to just be aware of all of these things. And then the last thing is touch. So touch, you always want to make sure that you are asking permission before you touch anyone. When we get into our hands-on skills, things like that, you need to be aware of that too. Anytime I have a student coming into my training room, if I need to touch them for whatever reason, it's never inappropriate, I always ask permission. So some cultures do not like you to touch them, or they think it's disrespectful or some conflict with what their beliefs are. So it's just always asking for permission. If they don't want you to touch you, you can't touch them. So it's just important to, be aware of everything, and also address the issues as needed. And then just last thing, so summary, good communication skills obviously allow for development of good interpersonal relationships. So Communication skills are important in anything. They're so important in your job, and they're super important, obviously, right now, like I said, with distance learning. So just making sure that you are trying to constantly develop your communication skills. Like I said, I still am trying to develop my listening skills. But if you're able to do that, your patients will then feel accepted. They'll feel as if someone actually cares about them. They're not just a number. And then they also will have confidence in whatever care they are receiving. They will trust you, especially if they're in there for multiple days. Um, their experience is just going to be overall better. So just keep in mind, I like to think of healthcare as you're not only treating the person, but you're also treating like their mind. That's high quality patient care. So if you can understand the psychological things that they're going through, you're able to communicate things clearly with them, then they're going to feel like you actually care. They're going to feel confident in you. They're going to trust you. And then that also is super important. You need to be able to relate to your coworkers because you don't want to have issues um, at your job. Everything that happens outside of work or any personal things that happen at work, you need to kind of keep away from your patient care. So, again, some of this stuff, I know some students do not plan on working in healthcare, but I think a lot of this stuff just is kind of universal with everything. If you plan on having a job, you still need to be aware of your verbal and nonverbal. You still need to be aware of your listening skills. You still need to be aware of other people's, you know, barriers to communication. So if you plan on working at Starbucks, you're going to obviously deal with people that need to order things. So if they can't, hear or maybe speak, you have to be aware of that as well. So again, make sure you are turning in your notes by the end of the period. If you have any questions, feel free to reach out to me. And we are done with this section of notes. It's going to basically transition us into next week. We will start covering careers in healthcare. So this kind of goes with a little bit background for that. So anyways, turn your notes and I will see you guys tomorrow. Have a good day.